Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sadhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Phone number 408-687-1899 and email address homeomedicine HOMEOMEDICINE at yahoo.com. Even when you cannot call me and you want to discuss about your health, or you are suffering from any disease and you want to take a second opinion, or you are fed up from any treatments at any age, call me for free consultation. There is no consultancy fees. You can call at 408-687-1899 or the email address. You can send your questions on email to get your answer in time and decide what to do about your health, what way you should go for the treatment, or what way you are already taking treatment and it's going in what direction. So everything I can guide you based on the natural principle, how the nature was curing all these diseases, whatever are prevailing at this time. Before the medical science was present here, before the medical science exists, ultimately this medicine science is existed because of the experiments, because of our knowledge, because of our collection of previous thoughts, of previous happenings. And after that, this collection has resulted in a definite type of principles. And those principles are guiding our treatment, guiding to specially name of any disease and a particular type of change happening in our system. This is guided by our medical science, and that medical science is the resultant of our continued watching how the nature was curing all these things. Nowadays, most of the adulterated diseases we are seeing. Previously, there was not much number of diseases, only limited type of diseases. Some of the diseases were concerned with the summer season. Some of the diseases were concerned with the winter season, and some of them with rainy season or the dry, wet areas. In this way, diseases were very limited. And also, when a season change, diseases occurring in one season, just for example, pneumonia, cough, bronchitis, all these things, these are the diseases which mostly happens during winter seasons. And when it comes summer, they automatically go because the season is helping to our vitality to overcome all these. Even during the season, at every moment, our vitality, the life force inside this body is protecting us, trying to evacuate all evil influences, means all type of diseases or all type of influences which are producing diseases, means which are producing changes in our day-to-day working of our life, working of our body. That is called disease. But nature was helping himself. Nature was, because we are the creature of nature, nature was helping himself, and this body was cured mostly because there were not much reasoning behind it. Reasoning means the causes which can initiate a disease, which can explore, which can expand the process of disease inside our body. This was a normal process previously, but nowadays adulteration has occurred in our food. Adulteration has been occurred in our environment. Adulteration has been occurred in our day-to-day routine of life. So everything is adding to the diseases, and everything is creating a new name to the diseases, a new type of diagnosis we are doing day to day. And also because in the natural phenomena, our living behavior is added. In a natural phenomena of disease producing, our habit, eating habits, foods, and all that, because most of the foods are preserved nowadays, we are not taking the natural foods. In this way, many of the things are changed and they have adulterated the disease process. Or you can say they are a type of hindrance, blockage to our vitality to cure the system in a normal way. In other words, I can say the nature was having only the natural hurdles which were going automatically itself, but the nature was following those things, and ultimately the patient was cured. But nowadays, the causative factor are not only the seasons, causative factors, not only the natural things, but adulterated things of our food, of our environment, of our living habits. All these things are adding to our disease processes. And that is why, in spite of natural treatment, in spite of adopting a natural way of treatments, we need to add something to combat with the food, adulterated food, to combat with the environmental changes, and all these things we are adding day to day to our treatments. In this way, medicines are becoming more and more complicated every day. And every day, the body itself is also trying to overcome all these hurdles and also the nature of disease. In this way, something new comes up which you do not expect, which is not expected, and we do not expect in the course of the disease. That is known as pathology. That is known as the complication of the disease, because the vitality has to fight on one side with the natural disease, on the other side, the adulterated forms of our life. In this way, the vitality has to fight on both sides. We are trying, we are trying to overcome the causes or the adulterated causes which are complicating the disease, the natural disease process, as far as it is possible. But it is not possible nowadays to overcome all the hurdles, to overcome all the complications which a person may suffer, which a person is normally living in. We are living in the same environment, we cannot change it. And the environment is changed by pesticides. Environment has been changed by the smoke, by all type of factory complications, excess of vehicles, perfumes, and all those things. That has been complicated with that one, and that you cannot avoid. But what you can avoid? You can change some individual habits of sick person, not overall. You can change your habits, living habits. You can change your diet plan. You can change your overall the things which make you sick. But it is difficult. We are bound to live in this environment. We are bound to breathe in this environment. Under those conditions, most of the things we can cure, but all these things are temporarily. And ultimately, we have to again go to the same environment with the same seasons, with the same complications. adulterations of the environment, food, habits, and everything. We are bound to. We are bound to live in that one. Under those conditions, we cannot say that we are curing the disease forever. We are unable to do that. But ultimately, under such circumstances, what we can do? We can do that whatever is under our control, means food. Try to change the food. You can change. Just like nowadays, you can see the people are having cylinders in their hands to just take more oxygen, because the concentration of the environment oxygen is less as compared. We need that. It's less than that. Under those conditions, we need to provide a sick person the maximum capacity of the air or oxygen, and then they take a cylinder with them. Many of the conditions we are just managing in this way. Some of the alternative measures we are using, just like just we are talking about the lungs, and there is a person is having any breathlessness or any respiratory problems, maybe bronchitis, maybe asthma, maybe whatever it is, and temporarily what we are adding to soothe the condition, to make him painless, just to give something which can dilate the blood vessels, which can dilate the bronchus, the air passages, so that temporarily he will feel better. But ultimately, remember, ultimately a patient is cured not with medicines. Medicines are only protecting you from another adulteration, from other complications, which may arise during the course of repair of this body, during the course of, you can say, the cure. A person is sick, and now the vitality is trying to cure it, make it healthy, and ultimately during this course, it should not be complicated with anything. That is why we give the medications. And when the vitality is protected from another complications outwardly during sick condition, then it can easily has only one task: to fight with the present inimical forces, to present condition of the disease, or present sources which are producing the disease, not the other complications. So the medications, whatever you are doing, even cancer, even ulcerations, whatever, medicines are just protecting you from another complications. Though this disease may be because of some complications, disease may be of some adulterations, but now it has been adulterated, and the vitality is trying to overcome this phenomena, this phase of the sickness. And ultimately, if another complication comes up on that, it will be difficult, it will linger on the process of our cure. But if we are, whatever we are giving for the medicines, that does not cure. Listen, medicines are not curing the diseases. This is the big thing I'm saying. Medicines, because this repair of this body is internal. It's not like any physical structure of a home or a wall or anything which you can repair it from outside by any means. No, not at all. All the repair of this body is internal according to its own process of repair. You cannot add to that one. You can just help that one. In what way? We know the repair process needs vitamin C, repair process needs vitamin K, repair processes need the materials, whatever is required to fill up the gap, the ulceration or whatever, or remove the excess collections, tumors, whatever inside the body. But we need that to withdraw something, to add something, and that you can just help into that, but you cannot do yourself. You can help the vitality, but it is the vitality who will do all everything, but you have to support him. In this way, In this way, we must keep in mind that all the treatments whatsoever is going on in the world, they are all protecting to you during your sickness. When you are taking these medications during your sickness, all the medications are protecting you from another adulterations. And we have just now talked about the adulteration is now universal. Environment, foods, habits. Now they are becoming universal habits, universal complications with which body, vitality resist, but ultimately becomes weak. Resist and become weak means sometimes you are passing through any environment. You are living in an office where all the people are running under a high speed of AC, cold temperatures. Yes, you are also doing the work in the same environment, and ultimately a time comes after a few years that you feel more sick, you feel weakness, you feel feverish, you feel pain, body and everything. Every person is living over there. That has become a routine of the office, and you have to work in those conditions. But ultimately, if you withdraw this thing for a short period, you can experience this thing that yes, this was the cause. This was the cause, and you have to rule it out if you want to get rid of this thing. If you want to get rid of this thing, then you have to rule out all these causes. Whatever is you are thinking, and previously in my these lectures I have described you, the causes are not the physical causes which we are considering nowadays in the modern medical science, the bacteria, virus, fungus, protozoas. These are four kinds of the physical type of visible material causes which we are thinking that the modern medical science is thinking that they are producing the causes disease, but actually they are not. Many a times experimented that even after the presence of all these bacteria in the environment, all these viruses in the environments, people are not suffering from that one. People are not affected with that one, that disease. That indicates that everything depends upon the response of our vitality. If our vitality is strong enough to fight back with these type of environment surrounding bacteria, viruses and everything, person will not suffer. But those who are having weak immunity, that's called the immunity, and weak resistance against any type of bacteria, against any type of virus, or against any type of disease producing organisms, those person will suffer from the disease. And it's not for all. So, whosoever is suffering from any type of ailments, for any type of disease, he should search about, search about his exciting factors. What are the exciting factors? Oh, if I take cold, I suffer from that one. If I sleep uncovering my head, oh, if I suffer from that one. If I go to take this and that kind of foods and this, and then I suffer because most of the people are addicted to go to the hotels, restaurants, and take that kind of foods. And they make the spicy foods that attracts the customers, and ultimately 1 or 2 days you can continue that one, but not always. But when you are taking always that spicy foods, chatpata foods, ultimately your vitality will say hands are up. We cannot be this type of foods. It's excess from our capacity, then you will fall sick. Then you will fall sick. Under those conditions, you need to survey your food habits. You need to survey the environment you are living in. And ultimately, if after changing all these things, you get well in a short period, in a short absence of these kind of things, then you must guide yourself to protect yourself from these kind of causative factors, because you are suffering from all these things. So in this way, you can rule out many things. Some of the causative factors are just exciting factors. Temporarily, you are in heat in the room and you go outside and there is a cold outside, but you did not cover yourself. You did not cover your nose, eyes, ears, throat, everything. And ultimately, you come back and you cough, and ultimately some of people may be having fever and all those things. Depends upon the resistance, depends upon the weakness in resistance of individual persons against that vital exposure, that cold exposure. It depends upon that one. But if something is going on continuously as a causative type of exposures which are producing the disease symptoms or making you sick, then you have to find out all those things. And continuously you are living in that environment, that is known as maintaining causes. Conditions, you are not accepting those things. Your body vitality is not accepting this kind of conditions and falling sick. But you are bound to live in that one. You are bound to eat that kind of food. You bind to live in that, work in that environments. Under those conditions, you have to survey. If you want to get rid of these conditions permanently, then you have to make a decision of your own, that whether you want to suffer continuously or whether you want to get rid of this one. And if you want to get rid of this one, these are known as the maintaining causes. And because you were not thinking, you were thinking, oh, this type of environment of AC and everything is in every office and everybody is working, why I am suffering? No, this is not the reason. But if you go out of that AC environment, ultimately you feel better. It does it. It indicates that this was the main cause, and your individual reaction to this environment is weak, and respond as a sick symptoms. And you have to. It's not that if other people are working normally in this environment, and if you are not able to work in this environment, and you should not remove that. No, you should. And every day eating a different food, spicy food, ultimately a time comes that then the body will say, hands are up, we cannot be at this type of spicy foods. But you will not blaming to that spicy food, because it's our routine. It's not only that 1 or 2 days. Since many years we are taking this kind of food, spicy and everything. No, this is not the reasons. Then how you will agree to this point, that this food or eating habit is your enemy, it is making you sick? Then you have to avoid those foods for a certain period of time. And when you avoid that one, then ultimately you will see the results. Then you will believe it. All these things. First of all, many times I have given you examples about that one, that if you smell something in your room and you could not find out, you could not trace this thing from where the smell is coming, and ultimately what we'll do, we'll remove everything from the room and bundle everything, and ultimately we will clean, we will see, we will watch every substance and bring it back into the rooms. And ultimately we will come across that substance, that bag, that particular the suitcase or everything which was smelling. Then it's easy for you to get rid of that one. And in this way, you can be disease free or smell free. The same way, when you work out to find out, you survey your life, day to day life, and you find out what is my routine, what things are making me sick. And if you avoid those things, and if you do not fall sick, You understand that this is the causative factor. Whatever. If other people are accepting that thing, they may. But if your body is not accepting that, if your body is not resistance to this type of foods, you have to change that. If your body is not resistant to this type of environments for the better health, you have to avoid those things. Like food, like environment, and all these things. If you survey those things, then most of the things will start going back. Most of the symptoms, the sick symptoms, will go back to its normal stage, and you will become disease free. Then, where is the role of the medicines? The role of the medicine is that to continue our day to day life. We do not want to lie on the bed. We have to work. We are bound to work. Otherwise, we cannot maintain our home life, household things. You need to work that one. And these medications, whatever you are taking, they are protecting you from externally complication for this thing, for this condition of the disease. So that will be protected. Otherwise, this is, suppose doctor says, okay, take this course of this medications for this these days and you will be disease free. Why they say like that one? They say because they are doing forcibly to run your vitality according to the demand, according to the power of this medicine. And that medicine is forcing your vitality to run fast. Just like you give some opium, you give some narcotics to work hard, to work fast to any person, and then he will do that. But ultimately, after the effect of this drug or substance, then ultimately he falls sick. Same thing with every medicines. It happens that you take those medications and you complete the course, and during the course of the medicines, you feel, yeah, yes, it's okay. But ultimately, after a short time, you come back with the similar type of symptoms because the underlying cause of that disease was not with that medicine. It is not curing that causative factors. No. If you are suffering from cold, if you are suffering from the environment things, if you are suffering from food things, unless you evacuate, unless you quit those foods, unless you walk away from that environment, you will not get well. These medications will make a concentration inside the body and will accelerate the function of your body so that ultimately, for a short period, you will overcome the environment, you will overcome the condition which was produced by the spicy food or different kind of foods which your body was not accepting. But it is not over. It's not going to cover everything. That is why there are lines in hospitals, there are lines in doctors' clinics, because the similar type of symptoms they are coming with. Because the medicines which were taken previously, that was not uh, repairing, or that was not making your vitality strong enough to bear all these things. And also, you are not taking care of the causative factors. You are not taking the care of exciting factors which are exciting these disease condition in your system, or you do not know about the maintaining factors which are maintaining the disease inside your body, and you are not aware of that one. Okay, this thing can happen, or this can cause this type of condition. No, it's not, because I'm taking this since long. So this is your view. So in this way, you at in the world in which we are living at this time, it is difficult to be isolated from all the environmental pollutions. It is difficult to avoid all type of preserved foods. We are unable to procure fresh foods fresh grown fruits, in the natural form of the fruits, food, fruit, everything, whatever you take, even the water, even the water has been adulterated, and we are taking the bottles and bottle and their concentration of nitrogenous substances to make them free from bacteria, all that, they are also causing you complications. They are also causing the disease condition inside your body. So in this way, most of the things you cannot avoid that. You are unable to in this world. In this way, you have to make your body more resistant to increase your immunity. And mostly, nature itself also is competent. Whenever any disease, any type of symptoms are coming as a disease, ultimately the next time our vitality becomes more stronger to fight back with these kind of infections. And they do most of the diseases, you know that they are very limited. And once they happen in the life, after that they do not come on the systems, because system itself resists, system itself develops power, immunity inside the body to fight this kind of infections if ever they again come into the system. That is why most of the diseases we do not suffer time and again in the life, but most of the diseases we suffer again and again. Time and again we suffer from that one. And for those diseases I'm talking here about with you, that you have to find it out what are the causes behind that. Though we are unable to avoid the environment, we are unable to avoid the conditions that yes, we are getting the preserved food and everything. But even then, you have to increase your immunity, so that immunity should be sufficient to fight back or to bear this kind of food materials, to fight back this kind of environment which your body was not accepting. You can change your foods, you can change your habits, you can make your body stronger by exercise, food materials, exercise, and all these things you can do in your life, so that you can remain healthy. Even once you have suffered from any type of disease, ultimately you will not suffer time and again from such type of conditions, because you are aware of the exciting factor, you are aware of the maintaining factor which are producing the disease or maintaining these conditions. There is another thing that is known as fundamental causes. I have talked about exciting causes. I have talked about the maintaining causes. And after that, sometimes it happens, oh, doctor, whatever you told me, I quit that job. I'm not working in that environment. And also, I'm not taking that kind of food. I'm trying to now there's a trend in the markets, natural substances, inorganic. This is inorganic. This is vegetable is inorganic. This is flours inorganic, wheat and everything. This is going on trend. But listen, you are sowing, buying anything as a food in your fields, and ultimately the Prague Kesar, if you know, rain, if you know, that you cannot avoid, that the rain, water, air, or the pollinations will come from the neighborhood fields and will adulterate your inorganic crop. And if they are adulterating, then what's the meaning of inorganic? Nothing. You cannot do that. But this is going on nowadays in the markets. Oh, this is inorganic. This is inorganic. And they are trying to produce these type of things, but they are not purely inorganic, because the pollinations because the air, because the rain, the water, fertilized water is coming from the other fields to your field as well. So you can avoid that. It means you have a condition that you have to live in this environment. And ultimately, you have to increase your resistance to be able to live in this environment safely and healthy. This is the main motive, main target of our health system at this time, that we should increase the immune. That's why you see that minerals, vitamins, capsules, this industry is flourishing. This industry is flourishing from our food. What we take, minerals, calcium, vitamins, all these things that we are taking from our food, any type of food. And those kind of foods are adulterated. Those kind of foods are not providing the sufficient quantity of energy, calories. But we are taking now, we are addicted to, we are bound to take the capsules, you take the tablets, you take the tonics, just to boost up our immune system, so that we can run in this world, whatever it is. It's adulterated word in the environment. It's adulterated of the food categories. It's adulterated of the habits. We are bound to live in those habits. But then you invite with you suffer from the diseases, and if you suffer from the diseases, then what you will do? You have to make yourself stronger. Your household expenses are increasing. What you will do? Beyond your job, you will do some extra job. Beyond your work, you will do some extra job, because your household expenses are increasing. And the household expenses are increasing, it means you have to compensate that. You are not going to homeless, okay? You are not going to do that one. But you will work hard as long as you are having a mentality that I have to fight about it. Under those conditions, the same thing for the health you have to do to boost up your immune systems. If ever you are not getting sufficient things which are required by the vitality to boost it up, to boost up the energy, then you should increase those things. In spite of taking medication and energy boosting things, these are two different things. These are the calorie boosting things, and those are the calorie spoiling things, because they are forcibly, it's a fight with the internal system. Medicines are forcing the internal system to work according to the medicines. That's why doctor says, okay, you have to take this capsule after this interval, after this interval, because they know the effect of this medication will be washed out by the vital system in this time. Then after that, again, if you want to force the vital system work according to your demand, then you have to give the medicine again. And ultimately, you advise, okay, after every 6 hours or after 8 hours, you have to take the medicines. And ultimately, don't think that your medicine has cured the disease. Not at all. I told you. Diseases are cured, the damages to the cells are repaired internally. But your medicines are giving you a temporary relief to maintain. But vitality has to bear up its pressure as well. But that is why, after every short period, it's evacuating from the body by urine, by stool, by sweating, by breathing. It's evacuating it from the body. Anyway, that is why the doctor says after this hour, after 4 hours, 6 hours, whatever, you have to repeat the medications, because they know that okay, this medicine will remain inside the system, will force this vitality to work according to this thing, not to feel pain. But ultimately, when the time will be over, this medicine will be evacuated from the system, and then you will again start feeling. That's why doctor repeated, whatever may be the disease, the easiest explanation of the sickness is the pain. Every whatever it may be, cancer, it may be ulceration, it may be rheumatoid, whatever. The easiest and one word explanation of any disease is a pain. And to relieve pain, medicines are working temporarily to force the vitality to work hard. And ultimately, vitality will exhaust. And vitality is trying to evacuate everything which they do not need, which forcibly has been put on it, to exclude it, so that it be free to work inside, free to repair the damaged systems, and ultimately it repairs. But some of the conditions which are incurable, type of cancer, type of these kind of things which are incurable, then for that one you need to take those that's why doctor says, oh, you have to take this medication continuously. Why? Because they think that the vitally is unable, our system, immune system, is unable to repair the damaged conditions, repair the damages in the cells by itself in a short period. It may take long timers, even it may take a time which our age is not permitting us. Under those conditions, doctor advises just like morphine for the cancer patients, for the patients who just they are having a little time for the life, and ultimately doctor advised to continue taking the medications under those conditions, so that the vitality surrenders against that medications, and these medications powerfully suppress all the phenomena which are which the patient realizes that he is having pain. Means that the nervous system, that connection, that sensation, they do not feel it. Under under the condition of that one, and in this way, we should be careful in this environment that whenever you fall sick, first of all, survey your routine of 72 hours. What you have taken, what you have changed in your routine, in your food, in your habits, or accidentally, if you have done anything which was not your routine, so you have to survey within 72 hours. And if you rule out all those things next after 72 hours, then ultimately, automatically, you will become healthy. Disease will be over. But if you are unable to survey all these things, and even after survey, you are unable to remove those things, it's beyond your limits, conditions. You cannot go out of job, then you have to work in the same office. And for you, it's not possible that only for you they will not make the AC on. They are too. So in the under some conditions, if the circumstances are unavoidable, then you have to think over that to make you not to make you every time sick. Therefore, you have to survey for the betterment of your health, and you should avoid all those causes which you think are attached to you, or you are exposed to them as exciting factors. You have taken pickles, you're having a sore throat and a cough. You have taken curds, you are having the same type of conditions. You have gone to the exposures, cold exposures, and you suffer from a cough and bronchitis and all those things and fever, whatever it is. So ultimately, you should think over that, and you should survey all these things, that these are the things causing sickness in my body. We have to avoid that. So I'm sorry, because this was a question arises to me, and that is why I have detailed, narrated everything to the best of my knowledge. But my topic today was to deal with the bones of the head. And in the remaining few minutes, I would like to tell you that we have discussed about the bones of the skull, parietal bones, frontal bones, occipital, sphenoid bone. All these bones we have discussed about that. And after that, we were discussing the bones of the neck, but one bone, and that is yesterday. We have already discussed about that one, but you should be aware of that one. That's the part of the skull. We are today dealing with the bones of the face, but this bone belongs to the skull. That is known as steloid process. And about that steloid process, I told you in the back of your ear, if you see that a horn type things, which is jumping from upside to downward, it descends like, and then that's known as a steroid process. And the purpose of this steroid process is this the you can say the part of temporal bone on both sides, just in between the eyes and the ears. And these two projections are attached to this sorry, temporal bone. They are the part of that one. And the purpose of this one is to attach some hinges, to attach some musculature, to attach some ligament of the muscles, to bind something, to make something. And that's why this thing has been projected downward from this temporal bone. And some muscles, styloglossal, or then this one, the stylohyoid muscles. All these things are attached to this steroid process to make it happen that your tongue can work normally, that your voice can come out normally, because it functions through a support to tongue and support to the voice, and also support to the swallowing process. How you swallow the things, it helps for that one. So this bone was the part of the skull. We have already described that. And after that, the hyoid bone. The hyoid bone is a U-shaped bone which is in front of our neck. You can say it's the neck bone, as the neck bone is known as. The purpose is of this hyoid bone. It's a movable bone. It's always movable bone with the movements of the throat. And ultimately, the purpose of this bone is also to help the tongue to swallow and also to speech and maintain the oxidation in and out from the larynx to the bronchus, from the bronchus to the larynx upward, or to the nose, you can say. So, this is the purpose of this bone. And after that, in front of this one, we have named a thyroid cartilage. That thyroid cartilage is a V shaped, not U shaped, it's a V shaped. Hyoid bone was U shaped. The thyroid cartilage is above that one, that is V shaped. And that you can say the Adam's apple. Sometimes you see something projected inside your neck. It's more prominent in men's, less prominent in the females. And this is the thyroid cartilage, which protects our respiratory passages, the larynx tube, so that the larynx tube can perform its normal function of in and out expiration and inspiration process to take the breathing in this way. So this was the function of this one, and also to produce deep voice. It helps in that one. So after that, we have discussed about the trachea. Trachea is a type of 10 to 12 centimeter long bone in front of our neck. It's flexible. It's a flexible 10 to 12 centimeter long bone, and it is in front of our larynx. Upside, it controls the main bronchus. Downside, it controls up to those branches. When the right bronchus and the left bronchus, it is up to that level, and then protects the respiratory passages. That's the larynx and the bronchus. It protects them so that if outside anything happens, so that the air passages should not be damaged. To protect those things, this hyoid bone functions for that one. And one thing more I told you about that one, this bone has cilia. That's the hair, just like antennas of our TVs has cilias, and they are the signaling switches for this trachea, how it has to move, how it has to protect, how it has to help the respiration processes in this airline or larynx, bronchus, right bronchus, left bronchus, all that. And if you find out this trachea from the backside, then ultimately we have to go back to the C6 vertebrae. About the vertebrae, I have already told you, but even then I will explain when the term will come up for the vertebral columns, that from the C6 up to the fifth T, thoracic vertebrae are 12, and from upward to downward, fifth vertebra, thoracic vertebra, and also from the upward, sixth C, because there are seven cervical vertebrae, and one, two, three, four, five, and from the sixth to fifth thoracic vertebra. This is the surface anatomy of this trachea. If you want to trace this trachea from the back side, where it is, sometimes it is impossible to help the trachea or to open the trachea from front side. Sometimes it is traced from the back side. So in this way, this trachea it has this surface anatomy. And after that, we have discussed about foramen magnum. Foramen magnum is a hole in the skull. You can say hole in the skull, which is in the occipital bone, as the bottom of the occipital bone, under the base of the occipital bone. And this is the main hole. Normally, it's like egg shaped, but it has a different type of shapes depending upon the substances, depending upon the organelles coming in and out from this foramen magnus, it may be little changed. Means everything from the skull goes to the vertebral column, just like the vertebral nerves, just like the CSF, cerebral spinal fluid, and everything from the skull goes to the vertebral column. And this is the only pathway. This is the pathway through which everything is exchanged from vertebral column to the skull. And in the skull, you know that there is a big village, and there are big houses in that as the organs, and they are performing their duty. They are relieving their garbage. They are taking food materials. They are taking the sensory nerves. All those things is passing through this foramen magnum. And this foramen magnum is the important thing which unites functionally the head with the body. And main work is to cooperate or to transport the things from skull, or you can say the inside of the skull, from all the organs to the vertebral column. Shapes may be different. It is assumed that it is a little bit smaller in the females and a little bit more bigger, you can say, it is in the male sides. And main medulla oblongata, spinal cord, meninges, vertebral arteries, and vertebral nerves, all these passes through this foramen magnums. So in this way, this was our yesterday's English Punjabi lecture that I described about. I can again repeat these things. So today we have discussed about the styloid process. The styloid process was the part of our temporal bone. This was the part of our temporal bone. Temporal bone has already been discussed. These are two in number, and these are in between the eye and the ear. at the level of ears or eyes. These are in between that area, and that helps with the maintaining the temperature, you can say, inside, and whatever is felt inside the brain, we can realize, we can feel it, just like we had told you about the fontanelles. Talu, fontanelles, a gap inside the skull bones, a frontal fontanelles and the occipital fontanelles. The same way, he said that kind of things which is palpating, which is synchronous with the heartbeats. So this was we the first thing we had. And the styloid process is the part hanging downward in the back of the ear on both sides. And the purpose of this was to bind many musculatures, to bind many organs, just like the tonsil area, just like other larynx areas. All these things are their musculatures to keep them in positions are attached to this one steroid process. After that, we had discussed about the thyroid cartilage. You know that the thyroid is in front of our neck, and there is a isthmus. There is a string in between two lobes which joins the both the lobes of the thyroid gland, and this is the in middle portion, and this is mostly V shapes, unites V shaped, and combine both the lobes of the thyroid gland, and also most of the functions and protect the respiratory pathway is also the function of this thing, and it depends upon and the development of the, you can say, testosterone hormone, and it's a deep, produces a deep hard voice. Also it helps in normal speech. All these things they help. And after that, we have discussed about the trachea, the main thing in the neck, which protects the respiratory organs, respiratory pipeline, and from above the trachea, bronchus, and the main bronchus, and the branches, right and left branches, which are the main function for the respiratory organs, and it helps to protect all that. And it has cilia for the sensation and feelings, and to get connections with each thing, to get changes according to the sensations, feelings, environments, because of their cilia. So this one is a trachea. And after that, we have discussed about the hyoid bones, which is just also in front of the bone, and you can see it in the front of that one. The sport also, it also supports the voice. It also supports the swallowing. When you swallow anything into the from the mouth downward, it helps in that one. It also helps the speech, how high you can speak. It helps in that one. And also it helps the larynx, because larynx tube starts from the nose backward up to the lungs. There are different portions, and nasopharynx, and after that epiglottis area, where these the two pharynx and larynx are joining, and after that the bronchus, main bronchus, then right and left bronchus. All these things are the respiratory organs, upper respiratory tract, you can say, and this thing help to protect this windpipe, you can say, windpipe in this way. So today our time is over. And again, I will repeat that if you find something in these lectures that this is helpful for you, then please convey this message to all your relatives, dear and nearest, so that they can understand how this body is formed, what's the function of each and everything. First of all, we are discussing about the structures of this body. And previously, since 1 year, our lectures are going on to discuss how life was created from life, from sperm to ovum, how it was created, how it was run throughout everything in the mother's womb, and after coming out of mother's womb, and after that, the step by step, how this life was developed and up to the adult age. And when after reaching to the adult age, we are going back to the the original thing, which is the milestone, which is the basic stone of this body, that is the cell. Then we described about the cell. What is a cell? What is the function? What are the organs inside the cell, and what they do? The different organs performs different type of duties inside the cell. We described everything, and after that we are discussing about this structure of the body, how the skull was formed, what are the bones which are forming the skulls, what are the bones of the neck, what are their functions, what they do in the neck. Ultimately all these things we have described in this way, and ultimately we'll go to the chest. What are the bones of the chest, how they are perform their duties, what is their duties, and all these things we will discuss step by step. And after that we will go back to the head, that what are the organs inside the head, and what's their structure, what they do, what their responsibility, if they fall sick, how they fall sick, and if they fall sick, what will happen to our body. So all these things, step by step, I'm going to explain with you in these lectures, and I hope you will help me to convey this message to the public, so that most of the publics can understand, can learn all these things, and understand and become remain healthy basically. And if ever they fall sick, they can be healthy very easily, because they will be knowing the causative factor, they will knowing the structure of this body, they will knowing that how this body structure is working, and they will knowing about the what can cause damages to this system, and how we can overcome all these systems. So God bless you all. This is Gurdeep Singh Sandhu, your homeopathy consultant, and my clinic address is 9701 Sarah N Court, Dublin, California 94568. Phone number 408 687 1899. Anytime if you are suffering from any disease and desperate of your treatment, please call me for your second opinion of the disease. I will let you know whether your treatment is going on the right line, right direction according to the nature's principle or not, or what will be the outcome of your treatments. And if ever you want to get treated with the specific homeopathic type of treatments, a natural principle, then you can call me 408 687 1899. God bless you. Rab Rakha. We'll see you tomorrow.